All right. Thanks so much for joining us today. We are the South Jersey Institute for Population Health, and today we are going to be sharing our latest funding initiative. And so, this is one of our biggest initiatives of the year where we focus on funding community engaged research that improves health outcomes in the South Jersey region. So, that's why we're here. We're excited to share it with you, and we're going to dive right in. Um, First of all, I'm here with Dr. Bob Weaver, who's the co-lead for the South Jersey Institute of Population Health from Rowan University. I'm Dr. Stephen Danley, the co-lead from Rutgers Camden University and the director of the Center for Urban Research and Education. We'll be guiding you through today's agenda. So I'll be talking a little bit about what SJIPH is, our values, what it means for our funding initiative, the purpose of our funding, and then I'll hand it over to Bob to get you into the details about RFP and how you can get funding for your important projects. So let's start with the basics. SJIPH was established through a state grant by the Rowan University Rutgers Camden Board of Governors. And really, our goal is to improve health outcomes and health determinants across the South Jersey region, where there's a lot of need. I always talk about state politics in terms of football fans. A lot of dollars go north to Giants fans, and often fewer dollars go south to Eagles fans. And we see the impact of that. We know there's a lot of need in South Jersey on issues of health. And one of the things we do here is try to bring resources to the table for that endeavor. And so you can see that in our goals. We're trying to improve health and health outcomes with a focus on population health, population medicine, public health approaches. And we really believe the way you do that is by engaging directly with community. And so you see, as we turn to kind of our funding mechanism, we are designing community engaged research grants that involve faculty from Rutgers and or Rowan University and community organizations that do work in South Jersey. And those teams are producing projects, that's hopefully you for this funding, projects that improve health outcome that are research focused. So what does that look like? You can see this really draws on our values at SJIPH. This value of collaboration, that this work can only happen if it comes from the ground up, if it's connected to the work that's already being done in communities to improve health outcomes. Innovation, we want to see new ideas. We want to be able to kind of move forward with some of these, and impact. There has to be kind of an outcome piece of this. We want health outcomes, health disparities. We want to be able to identify these issues and have solutions for these issues. So our theory of change is that we can do that by funding community engaged research. And so I'll really focus here on point number 2, which is expanding research. What does that look like? We want to see research in a geographical area of South Jersey. You can see the counties listed here: Burlington, Camden, Gloucester, Cumberland, Salem, Atlantic, and Cape May. And then we want to see research teams. These are the partnerships. Those involve Rutgers and Rowan University faculty, as well as community organizations. And the point of this is that our theory of change is research can help to address health outcomes. So all of our projects are community engaged research focused, which is to say we don't directly fund implementation or programming. We don't fund a youth program. What we will do is fund research that goes towards understanding a youth program, and in some cases, resources from that research, and this is the beauty of community engaged research, can go towards helping to make sure that happens. We often call that a pilot project, right? Where we pilot a new idea we have, but we're also gathering data on its impact. And the idea is by using these proof of concepts, we can both see immediate health outcomes that come out of this work, but also build a body of knowledge that helps us to address these problems at scale. So that's what we're doing. That's our theory of change and our model for this funding. I'm going to go ahead and hand it over to Bob to go through all the details with you.
Thank you, Steve. This slide indicates the key dates to think about when you're thinking about applying for Cycle 4 funding. And one of the dates that I wanted to point out is November 14th, 2025, about 7 months from now, where the a final proposal, a refined version of what you want to do research-wise, will be submitted for an assessment. So that's sort of a target goal, and in the process, we will hopefully be able to shepherd and help you refine your research proposals, starting with the letter of interest, which or letter of intent, which is due on July 14th. So there's going to be a release, an announcement for the application that's it's cycle 4, not cycle 3, on May 2nd. And then the proposal or the letter of interest, letter of intent will be due on July 14th. After which a committee will review the letter of interest, the proposals or the letters of intent will be screened, and some will be invited to a sandbox meeting. And if you're one of the ones that are invited, the most promising LOIs, and you get invited, it's important to note October 10th as a key date, because the expectation is that some members of your research team will attend what we call the sandbox meeting at SGIPH's Health Science Center on October 10th. Stephen will have more to say about the sandbox meeting, but it's important, it's critical that your team has attendance at that meeting. And then at that meeting, we'll be refining your proposal, giving you ideas for improving upon it so that it's ready to be submitted on November 14th. After which, there will be award decisions, funds will be released, and your project will ensue. So those are the key dates, yes. And these are the 5 areas for the LOI to think about. First of all, we're kind of expecting a couple, 2 to 3 paragraphs, a maximum of 2,000 words for each of these central questions, which you will address in the LOI. Does the research question align with the goals of the RFP in terms of health impact? So, of course, as Stephen suggested, SGIPH is interested in improving health outcomes in South Jersey, and this includes the social determinants of health. Sometimes health outcomes and positive impacts occur, take years to manifest themselves, but social determinants can be addressed almost immediately. So we're interested in research that looks at or addresses social determinants of health, as well as health outcomes. As Stephen mentioned, we're also looking for strong collaborative research teams. The partnership model that we're looking at, where institutions, Rutgers and Rowan, Rutgers, Camden, and Rowan unite or work with community-based organizations to develop a partnership. And this partnership, we hope, will remain stable, and by working together, synergies will develop, and a kind of a stable, sustainable partnership will evolve over time. And then the LOI will be asking for what kind of impact, what is the projected impact on health and health outcomes, and is the project that you're imagining, that you're writing about and looking at, feasible within the constraints of the budget allotted. So those are the 5 key areas that you will be addressing in the LOI.
Yep. And before we move on to the next slide, I just wanted to say each of these sections, it's about 2,000 characters, which is a little closer to 250 words. You know,
I said
Bob has
2,000 words.
tenure because he's asking you to write 2,000 word essays, but we're keeping it a little simpler this time.
Sorry. Yeah. So, so the review process, this is all the LOIs that are submitted will be reviewed by SGIPH and some of the reviewers. And these reviewers are include faculty from Rowan University, faculty from Rutgers Camden, community stakeholders, and other people who are familiar with the research process and have experience in collaborative community-based research and understand that process. In addition, there's going to be a scoring criteria, a 5-point scale that will assess the 5 elements of the LOI: the research idea, the collaborative team, impact, sustainability, and budget feasibility. So there will be 2 funding tracks in Cycle 4. Track 1 we call Catalyst Grants. Catalyst grants include pilot projects or projects that are funded up to $25,000. All project teams are eligible for Track 1, and this funding will involve 18 months you have to carry out the project. Track 2 will include the signature grants, which are larger projects between $50,000 and $100,000. Typically, the signature grants will involve project teams that are more well-established, that have perhaps received funds from prior sources or from SGIPH previously, and have shown a record of successful collaboration and completion of a prior project. This will be for 24 months. And so the scope of the signature grants will be considerably larger than the Catalyst grants. The signature grants must include partners from both universities, both Rutgers Camden and Rowan University. We encourage people, since we will not be able to fund as many signature grants as Catalyst grants, we encourage researchers to apply for both. So take it away, Stephen.
All right. So Bob and I put together a frequently asked questions, and you can find it at our website, sgiph.org. You can also find it at the application portal, which is linked through the website or through emails you're getting from us at SGIPH. If you have questions that aren't in that frequently asked questions, you can go ahead and use this email, info@sgiph.org, or you can just reach out to Bob and I. We're accessible. We're here. But I do want to walk through just a few things we get a lot of questions about today and just give you a little sense of the shape of that document. So the first thing here is the sandbox meeting. Folks often ask us about this, and this was the brainchild of SGIPH founder, Dr. Nicole Vaughn, who's on sabbatical now, but we anticipate will be rejoining us over the summer. And Nicole really, I think, put a lot of what I would consider best funding practices into this meeting, which is the idea that we don't want to just be referees as a funder. We want to be collaborators. We want to work with you. We want you to have feedback along the way, so it's not just kind of like a black box that you apply to. And the sandbox meeting is really our way to put that into action. After you've completed an LOI, which in our case is kind of a scaled down application, again, 2,000 characters for each of these questions, should be relatively straightforward. We're going to take the most promising LOIs and invite them to a workshop meeting. The sandbox is your chance to get feedback from our reviewers, to get feedback on how the project can be strengthened, and really our first place to exercise the idea that these are about collaboration, not just with your team between faculty members and a community organization, but also with us. And so what we do is we go through a day, you learn about other folks' projects, you workshop your own projects, and you get a detailed list of things you can do to improve your project in the final application, which is November 4th. And so this is required. It's a key part of our funding, and we do require you bring at least one academic partner and one community partner. The event will be October 10th. And I will just say, this is one of my favorite days of the year. It's when all this stuff kind of becomes live and you realize we're not doing this work in isolation. We're doing it in community and get to be a part of something larger. So I'm looking forward to it and can't wait to see you there. The frequently asked questions also addresses a whole host of other issues, some general questions and answers about the funding tracks. If you're more interested in those funding tracks, how to make that decision, eligibility for the grant, the geographic eligibility, what our focus is, what we kind of look at for these partnerships. We have more details about the application process, the steps. An important note is that we do require that the PIs on these projects be faculty from universities, and that's largely for IRB reasons. If you know, IRB can be quite an adventure with some of these community engaged projects. And so this helps it go a little smoother. Details on the LOI and the sandbox. We have all the nitty gritty details around allowable expenses. If you have other funding already for the project, how do you list that in the application? Those types of things. We love seeing projects that are funded in other places. So don't hesitate to include that. But the frequently asked questions includes how. Details about the partnerships, again, with the key distinction here being catalysts only require a faculty member from Rutgers or Rowan University. The signature grants require partners from both, and all the grants require a community partner. There's questions in here about who counts as a Rutgers or a Rowan faculty member. And so you can get into the details if you have questions about if your team qualifies or if you need to add to it to be eligible for our funding. All the details about our LOI, our format, what happens afterwards. We try to keep these things straightforward, but obviously there's post-award requirements. And any other resources you may need. So again, I'll emphasize, we took a lot of time with this frequently asked questions to try to get out in front of it, to think about what your needs were, so this can be as straightforward a process as possible. But I know the devil's in the details. So we advise you kind of take a look at our website or the application portal and go through those frequently asked questions. I'll just wrap up today by saying it's a tremendous honor to be partners in this work. We're really excited about this vision that we can address health outcomes, health determinants through community engaged scholarship, and this belief that these solutions really start from the ground up, and that by pairing faculty members with community organizations and funding, frankly, the great work you're already doing, we can be a part of that solution and that excited work. So we're really looking forward to your application. We can't wait to see you at the Sandbox. Thanks so much for being here today, and thanks so much for the work that you do.
Thanks, everyone.